Hi there. Siri and her team have very nicely defined resilience as the capacity to adapt to challenges and changes at different system levels to maintain high quality care. This study also draws on the frameworks of Holnagel on resilience potentials and on Berg and Assay on resilient characteristics. So for this study, we conducted a secondary analysis of interview data collected as part of a larger study to examine resilient characteristics across varying system levels during the implementation of a large-scale community-based mental health intervention. Semi-structured interviews were conducted at 4 intervention sites in Australia with the intervention coordinators and the central implementation management team. We conducted a thematic analysis of the interview data using a hybrid deductive-inductive approach with the aforementioned resilience frameworks guiding the deductive analysis. And what we found were strong indicators of resilient characteristics at multiple system levels. I won't read out all the quotes, but just a couple as examples. At the team level, for anticipation, as things are growing, we were sort of prioritising things and thinking forward, but also keeping the current processes happening. At the management level for monitoring, collect data to see whether it works and then feed that back to the sites. So work with the sites and make sure they're getting timely data on what implementation strategies are working and which ones aren't, and then revise. At the individual and team levels, we also identified strategies used by the site coordinators to promote resilience, such as building relationships and networks to respond to unexpected variance in processes between organisations. And at the management and organisational levels, we identified several barriers posing threats to the successful implementation of the intervention, such as inadequate resources, which drove the need for resilient performance at both the individual and team levels. However, it was very clear that this came with negative consequences to the individuals enacting resilient work practices. An example quote was, "To be frank, I've had 3 breakdowns on this project where I've had to be off work for a couple of days." So just some final points. It appears that resilient performance is needed across all system levels. And barriers and constraints at one level can have negative impacts on the next level. And a question I'd like to ask the group: is resilience at the individual level an important form of system resilience? Thank you.